I come to the floor today to pay tribute to a revered and distinguished member of the press corps, Robert Pear, a longtime reporter for the New York Times. He spent 4 decades in the corridors of the U.S. Capitol. I often say that journalists are the watchdogs of democracy, and I really believe that. Policing their beats to inform the public, and more importantly, to hold wrongdoers, and especially our big government, accountable. That makes them very valuable to preserving our representative system of government. These journalists serve as the eyes and ears of the American people, reporting on issues that impact the daily lives and livelihoods of our neighbors. From crime to education, health care, foreign policy, journalists serve as guardians of the First Amendment. So that brings me to Robert. On Tuesday, the health care beat lost a legendary reporter. The death of Robert Pear will be mourned for many years to come. As the Dean of the National Healthcare Reporters, he established a reputation for hard-nosed reporting. For decades, he carried out a noble mission to inform the public, and he did it with integrity and fairness. He leaves behind a legacy of unmatched institutional knowledge, particularly in the area of healthcare policy. As a policymaker and a history buff myself, I read as much news as I can possibly get my hands on. On weekends, I catch up on my readings when traveling to and from Iowa. For every year I served in the United States Senate, Mr. Pear's byline has appeared in the New York Times. I'm told that it appeared more than 6,700 times. It's a byline that I made sure not to miss. His work put meat on the bones of our public policy. Even those of us that study legislation closely can still learn a lot, and did learn a lot from his writings. Substantive and crisp, his exceptional reporting delivered a thorough analysis of complex issues, and then, without a doubt, influenced the policy conversation on health care. His prolific pen sharpened the minds of readers, including staff and lawmakers who wrote legislation here on Capitol Hill. And it even informed lobbyists who worked to penetrate and influence the debate. His work carried weight with those who implemented health care policy from the executive branch, including the White House, the Department of Health and Human Services, the Centers for Medicare and Medicaid Services, the National Institute of Health, and the Food and Drug Administration. Now that he's dead, his absence on the health care beat here on Capitol Hill will be missed profoundly. His understanding of the mechanics of health policy were without equal. He was able to wade through the weeds of archaic federal spending formulas for Medicare and Medicaid and deciphered their impact on the delivery of care in my rural communities, but also about urban America. Mr. Pear deftly communicated how proposed changes would affect patient care, from the point of service to the pharmaceutical counter and the pocketbooks of consumers. Policymakers, providers, patients, and the taxpayer have been well served by this giant of journalism. Unlike many of his peers, Mr. Pear shunned the spotlight shunning the spotlight by just doing the old-fashioned shoe leather reporting. Unassuming and understated, Mr. Pear let his published work speak for itself. And I'm sure you're going to hear from Ranking Member Wyden shortly, and he knows Mr. Pear very well and would agree with some of these things I say. Before holding a press conference to unveil a bill dealing with health care, any senator, including this one, had to be sure to have all your ducks in a row. No lawmaker wanted to be a sitting duck with Robert Pear in the front row of the press gaggle. I will miss his bylines, particularly the extent to which they helped educate me to understand policy that other members of Congress were promoting, and maybe even learning from his criticism of some stands that I took. Today, I extend my condolences to his families, friends, and the peers, and I salute his lifelong contribution to exemplary service on behalf of the American people, most importantly, policing the process of representative government and making sure that government and those of us that serve in government are accountable. I yield the floor.